Today we're going to be looking at ectopic pregnancy, and Juliana Naomi is my name. Ectopic means away from place or out of place. So ectopic pregnancy is any pregnancy that is out of place. And the proper place for a pregnancy to occur is the endometrium, that is the womb. Therefore, ectopic pregnancy refers to the implantation of a fertilized ovum in a location outside the normal endometrial cavity. The implantation can be in the fallopian tube, and that is the commonest site. In fact, about 97% of the cases of ectopic pregnancies occurs in the fallopian tube or the oviduct. That's the other name. The other sites are the cervix, the ovaries, the corneal region of the uterine cavity, even the abdominal cavity. The uterus is made to accommodate a developing fetus, and it has the capacity to accommodate even more than one fetus at a time until delivery. While the fallopian tube is a canal that links the uterus to the ovaries, what you may refer to as the egg chambers. So when an egg is released from the ovary, it goes into the fallopian tube to position itself for the sperm. And when the two meet, fertilization occurs, and a single cell is formed called the zygote. Now the zygote journeys back into the womb and it multiplies as it travels. This journey has a limited time, so once the time for it to reach its destination elapses, it implants wherever it finds itself, because it imagines that at this level of growth it has gotten to where it should, and it implants there. The faulty implantation that occurs in ectopic pregnancy is because of a defect in the anatomy or the normal functioning of the fallopian tube through which the zygote travels to get to the womb. With implantation in the fallopian tube, as gestation enlarges, it creates the potential for organ rupture, because only the uterine cavity is designed to expand to accommodate a fetal development. The fallopian tube is not built to house a baby. It's just a tiny narrow tube. So with expansion of the tube by developing fetus, there could be rupture, and blood vessels lining the tube are affected, which will consequently result in massive hemorrhage, severe lower abdominal pain, and even death. Ectopic pregnancy in other locations too can occur, but they are very rare. So a female within the reproductive years who comes in contact with a male genital organ afterwards now experiences cessation in her monthly flow should go for proper assessment, irrespective of the level of penetration to the vag. Sometimes some females will relax despite cessation of their monthly flow because there was no ejaculation into the vag. Please note that pregnancy can occur with the slightest seminal fluid on the vag. Once the fluid contains potent sperm cells, it can swim up to fallopian tube, and fertilization can occur, and pregnancy is achieved even without penetration. So please take notes. Now, what are the etiological risk factors for ectopic pregnancy? Whatever obstructs the migration of the zygotes, like things from scarring or adhesions of fallopian tube, either due to infections. PID is top on the list. Then salpingitis, that is just inflammation of the fallopian tube. Then, of course, surgical procedures can cause scarring and adhesions, like tubal ligation and some abdominal surgeries. Then another factor is history of previous ectopic pregnancy. If it had occurred before, whatever caused it may cause it again. Then altered tubal motility. Remember I explained that the zygote travels through the tube into the uterus. So ideally, the tube is supposed to be a smooth canal with cilia, hair-like structures to help propel the zygote through to the uterus. So anything that obstructs the flexibility of the cilia, like smoking, hormonal concentration like progesterone, these things will cause rigidity of the cilia, and it will obstruct that free flow of the zygote, and the zygote can get stuck and not get to the womb. Then history of 2 or more years of infertility, history of multiple sexual partners, increasing maternal age. Also, when pregnancy occurs with intrauterine device IUD in place, there's a tendency that the IUD occupies the womb, so the fertilized ovum will just start developing somewhere else where it finds a space. Ectopic pregnancy can also occur following induction of ovulation for assisted reproductive technology, a treatment for infertility. Then maternal in utero exposure to diethylstilbestrol. Diethylstilbestrol is a hormonal drug. So when a woman is pregnant with a female baby in her uterus and she takes this drug, that female baby might be exposed to having ectopic in future as an adult female. However, most patients presenting with ectopic pregnancy have no identifiable risk factors. Then the clinical features: one-sided lower abdominal pain. Two-sided ectopic pregnancy is rare, but it can occur, during which the patient will have bilateral lower abdominal pains. but mostly tubal ectopic pregnancy occurs on one side at a time. So the person comes down with one-sided severe lower abdominal pain. It's like an appendicitis pain. Then this pain is preceded by an amenorrhea. That's a cessation of menstrual flow. Just remember that for like 2 months, you've not seen your monthly flow and you're having this very bad pain. Then the next thing, vaginal bleeding starts. Then there's a red alert. You have to get yourself checked immediately. And not wait to pass out and be rushed to the hospital, to the ER, the emergency room, unconscious. A lot of men have been rushing into the emergency room unconscious, and they passed out because of bleeding. So please, you have to get yourself checked. Then other features like low blood pressure, increased pulse rate. Then of course, diagnosis of fetal pregnancy is made when a pregnancy test is positive and transvaginal scan does not reveal any intrauterine pregnancy, except when there's also a uterine pregnancy at the same time with the ectopic. That's what they refer to as heterotopic, although this condition is rare. Meanwhile, the pregnancy test that is done is called serum beta human chorionic gonadotrophin, beta HCG. The level of beta HCG in the blood is high, suggesting pregnancy has been achieved, but it's not increasing as it should, because in a normal pregnancy, every 2 to 3 days, the HCG level will double in quantity, the volume will double. While in ectopic pregnancy, it's not really doubling, but it's increasing slightly. So once that is seen, you diagnose fetal pregnancy. Then the treatment will depend on the clinical presentation of the patient. The fallopian tube may have ruptured or not ruptured. The treatment can be medical or surgical. The medical treatment is used after certain criteria are met by the patient, while surgical treatment, urgent laparotomy to arrest the bleeding and, take care of the situation can also be done. In fact, that's what is mostly done. Sometimes patients will come in, in an unconscious form, and you have to resuscitate the patient alongside the surgery. Now, here are the highlights to reduce the likely risk of developing ectopic pregnancy. Number 1 is decreasing the likelihood of infections like PID from chlamydia and gonorrhea. There's a complete health talk on PID on my channel. Do well to watch it. Then if you have any of the risk factors I've already mentioned, please make sure to see your doctor during the early stages of a pregnancy for proper assessments. Then when in doubt as whether or not you have missed your period and you may be pregnant, please go confirm your true status. It is safer and better. A close friend of mine lost her cosmate to ectopic pregnancy a few weeks ago, and it was so painful because this very lady left 2 amazing kids behind. Please know that ectopic pregnancy is the leading cause of pregnancy-related death in early pregnancy stage and is a common occurrence, and early detection can be life-saving. Thank you so much, and do well to share this information with someone so that together we can keep safe and stay alive. Thank you so much, and make sure this information is shared. Subscribe and then keep in tune with every information we have to bring on this channel. Thank you so much, and see you again.